Acentra Health is the beneficiary and family-centered care quality improvement organization for the 29 states highlighted on this map. Acentra Health helps people with Medicare file complaints about the quality of healthcare services they have received and make requests to appeal a hospital discharge, observation status, admission hospital-issued notices of non-coverage, or the stopping of skilled services such as physical therapy. We also offer immediate advocacy services when issues need to be taken care of right away. If you have Medicare and are unhappy with the medical care you received from a healthcare provider, you can file a quality of care complaint. This video goes over how to fill out the complaint form. No one enjoys filling out forms, but this one is short and simple. The first step is to fill out the Medicare patient's name. Then add the patient's Medicare number. If you don't know the number, you can find it on the patient's Medicare card. You can also find the number on a Medicare summary notice statement. It's a notice that people with original Medicare get in the mail every 3 months for their Medicare Part A and Part B covered services. Check the box for the sex of the Medicare patient and add the date of birth. We would appreciate if you would provide information on race and ethnicity. This isn't required for the complaint to move forward, but it helps us to know if we are reaching all populations with our services. If someone other than the Medicare patient is filling out the form, the Medicare patient will need to appoint him or her as a representative. We will include a link for the form to appoint a representative in the video description below. The representative's name and contact information also needs to be written on the complaint form. If the Medicare patient has died, the representative needs to be a legal representative, such as executor of the estate. Acentra Health will need representative paperwork to be sent in with the complaint. In the section where you are asked to briefly describe your concerns, please write out what happened. This should include dates, the name of the facility or staff involved, and a description of what happened. If you need more space than what's on the form, you may attach more sheets of paper. You may also send in other documents that you believe support your complaint. You can use the same form for more than one facility or doctor. You can also list out more than one complaint on the same form. This is an example of how to write a complaint. I went to ABC Hospital on January 3rd, 2021 for a procedure. I stayed in the hospital until January 6th when I was discharged. At that time, I did not receive instructions about what to do when I got home. I didn't have information about the home health agency that I was supposed to use. I wasn't sure what medication I was supposed to continue once I left. I felt that the discharge plan was not done correctly. Quality of care complaints can be filed for a variety of reasons. Some other examples of the types of complaints that Acentra Health can review are if you received the wrong medicine, if you were given the wrong dose of medicine, if you had a surgery or medical tests that you didn't need, if you were given a wrong diagnosis, or if your condition changed but it wasn't treated. There are things that Acentra Health is not able to review. These are things that would not be included in your medical record, such as if your hospital room was dirty or the nurse was rude to you. This process isn't about punishment or legal action. It's about listening to your concerns and making sure care meets professionally recognized standards of care. Once the form is completed and returned, the entire review process should be done within 6 to 8 weeks. The Acentra Health nurse will contact you by phone with the review results. If you're unhappy with the results, you can ask for a second review called a reconsideration, where another doctor will look at your medical record. The link for the form is included in the video description below. You can print out the form, fill it out, sign it, and then mail to Acentra Health. You can also download the form to your computer and type into it. If your computer is set up to sign forms digitally, you can sign electronically and then email to Acentra Health. If you have questions about Acentra Health or any of the content in this video, you can find our contact information on our website. If this video was helpful for you, subscribe to our YouTube channel. And don't forget to click on that bell to get notifications of new videos.